This lecture will be done for the first grade of Medical College AL-IRAQIA University. We will talk about today the upper limb nerves, which are started by the brachial plexus. We all know that the nerves in our body are arranged into plexuses, ضفائر, in order to give its nerve supply. طبعا we are talking about the somatic nervous system. We know we have an autonomic nervous system and a somatic nervous system. We are talking about the somatic nervous system, which are arranged into plexuses all over the body. One of them is the brachial plexus. The brachial plexus, there's an English quote says that Ron Taylor drinks cold portugal. If we take the first letter of each word, we can know the arrangement of the plexuses, which starts by the roots, forming the trunks, then the divisions, and the cords, then the branches. These branches will be distributed through the upper limb to reach its object in order to give its nerve supply. طبعا the brachial plexus are formed by the anterior primary rami of from C5 to T1. These are the spinal segments. We have the spinal segments, and the brachial plexus is from C5 to T1. It could have a branch from C4, or it could have a branch from T2 also. This is normal. It could be present in some individuals. If it is from C4, we call it a prefixed brachial plexus. And C5 will be slight smaller. If it is from T2, it will be called postfixed. And T1 by this will be smaller. But normally, or the general, have from C5 to T1, but this is for your information. You should know we have a prefixed brachial plexus or a postfixed brachial plexus. In this picture, we can see these are the roots. The roots are the anterior primary rami. We all know that from the spinal segment, we have a formation of the ventral root and the dorsal root. The ventral is the motor and the dorsal is the sensory. Both of them will unite to form the spinal nerve. The spinal nerve is a mixed nerve, so carries the sensory and the motor. Then the spinal nerve, when it arises from the intervertebral foramina, it will immediately divide into two rami, anterior primary rami, which forms the plexuses. One of them is the brachial, which we are talking about now. And also we have the posterior primary rami, which sends to the back and it supplies the sensory and motor supply to the muscles of the back. These are the roots, as we said, from C5 to T1, and the unite of C5, C6 will give me the upper trunk. The continuation of C7 will give me the middle trunk. The unite of the C7 and T1 will give me the lower trunk. So the trunks are upper, middle, and the lower. These trunks will then be divided into, we call them the divisions. After that, we will, from these divisions, طبعا the divisions are anterior divisions and the posterior divisions, or we can call them ventral and dorsal, same name. By the next picture, I will show you how the cords will be formed, but let's see here that these are the cords. The cords, we call it lateral, medial, and the posterior cord. And from each cord, there will be a rise of the branches, which will be, each branch will carry a name, and it has its own course and distribution anatomically to different regions in the upper limb in order to supply the muscles of the whole upper limb from its above, from the shoulder, distributing downward to the hand. In this next slide, we will see, I prefer for you to study it at the beginning as such in a diagram. تحفظوها بهالشكل هذا. يعني أنا أفضل إنه بالبداية تقروها مثل الدايجرام، وبعدين تقدروا تشوفوها على الصور، وبعدين تقدرون تشوفوها on real pictures on the cadaver or on the atlas, grants atlas، حتى تندلون each nerve موجود. طبعا بالمناسبة أنا هواية طلاب معودتهم إنه أكو أشياء أحبها وما أحبها، راح نستمر على هذا المنوال. وأحب أقول لكم إنه the roots of the brachial plexus you will find it in يعني on the model. إن شاء الله نطلع لكم موديل ونحاول نبين لكم شلون نقدر نوضح لكم الروتس، شلون نقدر نجيبها. أما يعني إنه نلح إنه هذا trunk وهذا division وهذا chord، no، على الموديل ما نلح هيجي كلش، بس نحاول نوضح لكم وين الروتس. بس البرانشز each nerve musculocutaneous, the median, the ulnar, the radial, the axillary are very important to be known، أو هي اللي نركز عليها on the body on يعني through its course and distribution. وإن شاء الله بالمحاضرات الجاية نحاول نعطيكم hint about each nerve where we like to bring it، يعني اللي هي mostly can be found in on the human being. فبس بالبداية أقرأ بشكل دايجرام بهالشكل هذا، وحاول تحفظه بهالشكل، هي شغلة لازم تحفظ. مثل ما قلنا إنه C5 and C6 will form the upper, C7 continuation gives us the middle, C8 and T1 will gives us the lower. Then the divisions, each one of them will give an anterior and posterior division. لاحظ عزيزي المشاهد، هاي يعني دائما همي أقولها، إنه the all posterior divisions of these trunks، يعني من تجيب ال posterior division of the upper وال posterior division of the middle وال posterior division of the lower، the three of them will unite to give me the posterior cord. راح يكون لي ال posterior cord اللي ultimately will give me the radial and the axillary branches, while the ventral branches of the upper and the middle will unite to form the lateral cord, and the continuation of the ventral division of the lower trunk will give me the medial cord. These are the cords. From the lateral cord, as we see, we will have the lateral division of, يعني from the lateral cord, we will have the musculocutaneous nerve. And as we see, the medial nerve will be formed by the lateral part and the medial part to form the medial nerve, and the medial also gives us the ulnar, the posterior gives the radial and the axillary. In this slide, we can see that we have several branches. The branches that I mentioned previously were the terminal branches or the end branches of the brachial plexus. But if we are asked that, are there branches that arises from the roots? Yes, I have two branches. As you see, this is one. And this is one, اللي هو the dorsal scapular nerve. And also I have the long thoracic nerve, which is from C5, C6, C7. Also, it is important for you to know, and you should know the root level of each nerve. يعني when we ask what is the root level of musculocutaneous nerve, of the axillary, of the median, and it is all present in the textbook. Also in our lecture, you will find it. You should know the level of each nerve. So we have the dorsal scapular nerve and the long thoracic nerve. طبعا the long thoracic nerve will supply the serratus anterior. Clinically, it is important. It will give us a clinical condition will be mentioned later in this lecture. And then we can find other branches that may arise, and this is from the roots, this is from the trunk, the suprascapular nerve, the nerve to subclavius. Also, we have these other branches. This is another view of the brachial plexus. Now we will talk slightly about the clinical anatomy regarding the brachial plexus injuries that could occur. شوفنا هاي الصورة كلش مبين بيها ال roots of the brachial plexus. The injury that could occurs to the brachial plexus, I have either avulsed or ruptured ruptured يعني فد مرة ينقطع. stretched يعني ينجر. avulsed يعني نقدر نقول يملص شوية من مكانه. هاي هنا موضحة. avulsed اللي هو من أصلا من الأبي مالته انقطع. ruptured يعني بالنص انقطع. stretched يعني انجر انشد من مكانه. But these three may give us the same clinical signs and symptoms of injuries to the brachial plexus. The typical brachial plexus injuries that could occur, one of them is called the Erbs Palsy. The Erbs Palsy, or another clinical term applied to it, we call it the policeman tip أو waiter's tip position. كنا نتخيل يعني شوف هاي الصورة هاي اللي هنا، كنا نتخيل شلون وضعية النادل اللي موجود بالمطعم شلون إنه يقدر ياخذ التب مالته، أو مع احترامنا للبوليسمان همينا من يرتشي ياخذها بهالطريقة هذه. So it is called a police